Welcome to the HealthChangers podcast presented by Cambia Health Solutions, where we share real stories of healthcare transformation from those experiencing it and those helping to make healthcare more personalized. I'm your host, Leslie. Until recently, there were 44 million caregivers in the United States. Now, in the midst of a global pandemic, we are all caregivers. Caregivers include frontline healthcare professionals, medical teams, grocery store workers, delivery drivers, and others, all of them working to find balance and trying to perform at work while not jeopardizing the care they're providing to loved ones. For this episode of HealthChangers, I spoke with two people who are working to provide caregivers the support and recognition they need to perform well amid some of the most challenging conditions they'll ever face. Peggy Maguire leads Cambia's company-wide strategy for serious illness and caregiver solutions. And Alex Drane is the co-founder of Archangels, a national movement recognizing and honoring caregivers. Alex, welcome to the HealthChangers show. We're really happy to have you here today and excited to learn more about Archangels, the movement that you're leading to recognize and honor caregivers. Tell us a little bit more about it.
We focus on caregivers because in our mind, they really are the epicenter of changing health and therefore life across our nation. And I think if that was true before, it is so much more true now. And so the company that we started before was a company called Eliza. Over the course of our life there, did over 1 billion interactions and really learned from people that while the healthcare system might think that diabetes or asthma or cardiovascular disease are the biggest diseases in the U.S., actually from the standpoint of an individual out in the wild, living their life, it's really things like caregiver stress, financial stress, relationship stress, and workplace stress. And if you define caregiver as anyone caring for someone that they love and feeling responsible for the health of that person, and we were focused originally on the unpaid caregiver, if that was 44 million people 3 weeks ago, if you expand that to what it is once you define a caregiver as being responsible for anyone who's at risk. And that just very quickly morphed from being, somebody who had a condition that you knew about and you were treating to anyone who is at risk. And this is even expanding over the last couple of days from, anybody who's we thought was over 60 or 70 with a pre-existing condition. And now we know, oh my gosh, no, it could be somebody who's 30. It could be somebody who's 20. Yeah. So the unpaid caregiver, those folks is massive. And then the paid caregivers, we're realizing it's any first-line worker, which can be first-line responders of any type, which includes, cashiers and stockers and logistics managers, people who help and keep food on the shelves. Yeah. So I think that the focus on that overall on caregivers as this vital component, it really is pretty much everybody now across the country.
Right. And I know this is a fast-moving situation. You mentioned just 3 weeks ago, 44 million caregivers in the U.S. How has the COVID-19 pandemic affected the culture of caregiving? And you mentioned grocery workers and healthcare workers and your neighbors. What are you seeing as we're all living in this stay-at-home? By the way, you're at home, right?
Yeah, I am at home.
Tell us where you're calling in from.
I'm calling from Beverly, Massachusetts, and from the warmth and safety of my house, where I'm lucky enough to have a home office, and I sit here thinking about my family members in Italy. I have two cousins who are I have tons of cousins there, but two cousins who are husband and wife. Well, they're not actually husband and wife as cousins, but one cousin. My cousin married this beautiful woman. They're both teachers. And in their apartment with them, their small apartment, they have 3 children under 5. And they are trying to be online teachers at the same time. And all of us across the U.S., we have examples like that of people who are struggling through what does it mean to work from home. For those of us who are lucky enough to get to do that. And then for the rest, what is it to feel safe in a world that's especially lacking PPE right now? So I'm very lucky in Beverly. I'm safe, and I'm sitting here feeling like many people do, I think, and that's really the origin of this notion that we ran by you guys that you've been so gorgeous to support, a feeling of helplessness, right? So what can we do to help in a time where there is so much need and we're stuck at home, literally? And this idea of how can you create moments of hope and love and things that people can feel good about in a time when there's a lot to feel not so good about. And it's funny, I was thinking about before this, Peggy, I know you love music, I love music. We all know Mark can actually sing. And there are a lot of beautiful songs out there that recognize the light that can come from the dark. And there was one I was listening to right before our call by Leonard Cohen called Anthem. And it has this line, ring the bells that still can ring, forget your perfect offering. There's a crack in everything, and that's how the light gets in. And I think this is that moment for caregiving. I think this is going to be a light for generations. Caregivers have really been the unsung heroes of our country. They've been invisible even to themselves. Like 50% wouldn't even have self-identified as a caregiver, let alone being recognized and their need to be supported being recognized by most employers and most health plans outside of you guys. And I think to change culture, you need to change conversations. And not only was no one talking about caregivers, there was really even shame around it. And one of my favorite examples is, when I was a mama to little babies, I could go to work and the person next to me would say, oh, Alex, like you have spit up all down your back. And everyone in the room would laugh. And that's so funny. Alex says spit up, ha ha. Because babies are cute and they're hopeful and they're full of optimism, right? This baby's going to grow up. It's very different. Up until, recently, you couldn't go to work and say you were scared because your mother with Alzheimer's had gotten out of the house and that you'd spent the night looking for her. And so I think this notion of this moment being unbelievably important is if this idea of changing culture is changing conversation. And that really is what Archangels has been all about, like getting that conversation started so caregivers could feel seen. But you don't even need a conversation starter right now because that is happening everywhere. We are all stressed about, oh my God, how do I care for my mom who lives in my house, in my town, but I can't physically get to her. She's across the country and I really can't get to her. And so I think this is a moment to ever change the culture of how caregivers are seen, how they are supported, how they are honored, and what we can do for them. And that in and of itself is a beautiful thing. And I think that is some light we can take from this dark.
Yeah, thank you for that. I want to turn to you, Peggy. First of all, maybe you can let us know where you are calling in from. And then I wanted to follow up with hearing a little bit more about your work and focus on caregivers and why you took the Look, Love, Lift pledge. And what does that mean to you?
Well, thank you so much, Leslie. And great to be on the phone with you both. I am on the opposite side of the country from where Alex is. I am in my home office in Portland, Oregon. And like Alex, I feel incredibly blessed to have a home and to be sitting in a room that has sunny yellow walls and looks out onto beautiful green trees in my backyard and in my neighborhood. And it's really nice to be with you today and to be sitting in this space. But
thank you.
Yeah, thank you. So much of what Alex said just resonated really strongly with me. This idea that culture change takes time, and we have been working at this for a long time, but this pandemic has really sped up a sense of urgency and is changing culture in a very positive way. I'm seeing caregivers everywhere. I think we're recognizing that being a caregiver is part of being a human being. And as Rosalind Carter said, and Alex, you were the first one who shared this quote with me, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is really and truly something that impacts all of us, and it's personal. It's incredibly personal. I realized that my first experience as a caregiver was when I was 23 years old, and I drove my dad to his chemotherapy appointments, and I fed him cantaloupe because for some reason he had a craving for it, and I helped him walk from his bedroom to the bathroom. I didn't realize it at that time, but I was a caregiver. In my professional life, as you both know, I've long advocated for palliative care. I think it's probably one of the most underrated and essential components of our healthcare system. The Cambia Health Foundation has invested more than $40 million to advance palliative care access, awareness, and quality. And I think you both know this, but I'll say this for other listeners. Palliative care is a specialty type of medicine that's focused on providing relief from the symptoms and stress of serious illness. And the goal is to improve the quality of life for both the patient and the family. So it's my work in palliative care and my exposure to palliative care that helped me understand that serious illness is not an issue that only impacts the person receiving the diagnosis, but it impacts the people who love and care for them as well. Now, my understanding of caregiving has expanded beyond those caring for someone with serious illness. But that's where my first exposure came, and my first understanding about the need to take care of caregivers, because I would see them in relationship to the person that they loved, and often caregivers would neglect their own needs in order to be there for someone that they loved, and they didn't think about it as caregiving. They just thought this is what you do.
Right.
Our regional health plans, introduced, I think back in 2014, introduced a comprehensive palliative care benefit that includes caregiver support. And when we designed our program, we really put the member and their caregiver at the center of the design principle. Our benefit covers in-home health care and psychosocial support, including family and marriage counseling. And we have a team of specialized nurse case managers who are available to our members, but also to their caregivers. And that's true regardless of whether their caregiver is insured by us. Our case management team tells me that 80% of the calls that they receive are from the caregiver, not the person with serious illness.
Oh, that's incredible.
Yeah. And we also noticed that as an employer, Cambia, I know you know this, but Cambia employs about 5,000 people. And we know that issues of serious illness care and caregiving really impact our employees as well. So we created a special employee resource group that meets monthly to support each other and to share stories and life hacks, if you will, and best practices. So we've done a lot to support caregivers. But the reason I took the pledge, getting to my long-winded answer to your question.
No, that's fine. Tell us first, what is the pledge, and then why you took it?
Well, okay, the pledge is really beautiful. It's beautiful in its simplicity. The pledge is to look for caregivers wherever you are, to see that. So to see them, that's the first part of it. The second part is to recognize the love that they're giving, what they're doing for others. And then the third part is to lift them up in some way. So it's a pledge to look, love, lift. Look for caregivers wherever you are. Recognize the love that they're giving and do something to lift them up. It could be as simple as getting them a cup of coffee from their favorite barista, or it could be a smile. It could be sending a note. It could be, giving them a bouquet of flowers. It's really something to say. It could be pointing them to resources that they need to get through the day. It really is that look, love, lift. The pledge is to recognize and support caregivers. And the reason that I took it is, well, one, based on my background. I told you we'd done a lot, but I also recognized that there was much more to be done, that we need to bring caregivers out of the shadows and into the spotlight. I think we really need to let people know they're not alone and that they're worthy of love and care for themselves, especially because of all the love that they give. So that's, I've just been really inspired by this movement and this culture change that Alex and her team are pioneering.
Oh, thank you for sharing that. Go ahead, Alex.
I just want to jump in because I think one of the biggest lifting examples I can give. It's so heartwarming to hear you describe it, Peggy, and thank you guys so much for supporting it the way that you have. You are beautiful in the way you talk about it and the way that you live it. But you talked about the comprehensive caregiver support from 2014, and you talked about family and marriage counseling being part of it. And I don't think that's something that most people, the behavioral health component and aspect of being a caregiver, I don't think most people have really paid attention to. And if there was ever a moment that we needed to pay attention to that, it is right now. I think this notion of a lift, a lift is anything from all the examples that Peggy just gave, starting with see someone and thank them, love on them as you can, fill the fridge of a first responder, connect somebody with someone who's been through something similar, connect them to the resources that completely kick butt, like the ones that Cambia has listed on their website. But it's also keep your eyes out for these other secondary effects and help people with those as well, because they will be quieter, but they will be deadly. And we need to do everything we can to be supporting the reality of the devastation that we're going to feel in a lot of ways across the country. And you guys are first responders. You're first responders in every single way. And I'm super grateful to you guys for that.
Thank you. I wanted to ask you both, what are some other ways, especially as our definition of caregiving has expanded and, many of us are now staying at home and caring for families and neighbors, but also people are going out and putting their lives on the line, the essential workers, the delivery drivers, the healthcare professionals. How can we continue to show them our support and appreciation for what they're doing during this really incredibly challenging time?
I guess I'll go first. My sister is a nurse, and her husband is working to convert buildings in the Chicago area into temporary hospitals. Or care centers. They are both deemed essential workers, and they have 2 sons, and they're also caring for his parents. So think about that, and I know their story is not unique, but I can't tell you how much I appreciate them and the love they are putting out into the world. And I think it's up to all of us to look around and see people like them and other essential workers like them through this campaign. For me, this is an opportunity to thank doctors, nurses, social workers, and other people who are on the front lines of this crisis and say, thank you. Thank you for what you're doing for on an individual level, but also on a societal level. I think we know the best thing we can do for people right now is to stay home and reduce the spread of the disease. But while we're staying at home, this campaign offers us a sense of hope and optimism, and it gives us a sense of connection and community during a time of isolation. And so I think I'm just blabbering now because I am so excited about this, but I think we as a community of people who care can connect with each other and demonstrate our appreciation for those who are caring for others.
Yeah.
Oh, I love that. You know, Peggy, I think one of the points you're making that I think is so important for all of us it is something that we can do. There's so many things we cannot do right now, but this is something that we can do. And you use the language, see them. And, you know, Peggy, you and I have been in a lot of meetings over the years where we talked about helping get caregivers to self-identify. Well, that's just yet another, and over the last 6 months, we've all evolved our language to like, it's not on the caregiver to have to self-identify. It's on us changing the culture so they are seen. And I think that is a part of this, right? We're creating this common language that lets us shine a light on these caregivers. And is this notion of, you know, you can show your appreciation, you can show this language, you can normalize and sort of culturalize that we see you caregivers by having this little badge that you stick on your email. So your gorgeous Cambia emails right now say Cambia, and then right next to it says, thank you for being a caregiver, and pushing it out on social media. And then even things as crazy as print out a poster, a flyer, stick it in your window, stick it on a tree, you know, put it in your mailbox. And then another way that I think you guys are supporting caregivers is you are, again, this notion of connecting people to the resources that exist that they would not have known about, nor would they have had the energy to go seek out, especially not now, and especially when there's so much misinformation. And so making it clear, here is a safe place for you to go. You can feel confident that the information you're getting about what COVID is, how it spreads, you know, what the next steps are for you. So the clinical, tactical things, but then also the emotional component. You know, what do you do if you're overwhelmed? What if you're worried and anxious? What are other, you know, tools that you can use to plan? And I love that you guys have that on your site. We've got that same stuff on our site too.
Yeah. You know what? One of my really good friends who is a caregiver herself, she shared a Helen Keller quote with me earlier this week. And it's that although the world is full of suffering, it is also full of the overcoming of it. And I love that quote because I think it's a perfect expression of what we're going through as a country right now, and as a human race, actually, you know, if you look around the world. But there is suffering, but there is also the overcoming of it. When you look at our shared caring, that the number of people who are stepping up to care for each other, and they're not doing it for credit, they're doing it because it's the right thing to do. And I think that it's this community that being connected to each other, and recognizing that any act of kindness matters, and that it lifts people up and helps create hope and optimism, even when we're going through something as difficult as a pandemic.
I love that notion of this process that you're moving through. I actually guess the funniest story, Peggy, you'll so appreciate this. Yesterday, my desk broke in the middle of the day, like literally broke, like fell over. Just the wheel fell off. It's a rolling desk. Everything went under the ground, including this massive, huge gift I'd gotten of a big fake champagne glass filled with candy, was crushed all over the ground. And, you know, the first thing I did was I kicked the desk, then I picked it up, then I kicked everything that was on the floor. And then I just sat on the floor and I cried. And I haven't cried in the last bit, because we're all like just going and doing and coping. And coming back to that notion of this process, right, and moving through it, I can't tell you how much better I felt after I cried. And I think another thing we can do for each other is, in acknowledging that this is hard, give yourself permission sometimes just to break down. I'm not proud. I would have loved to be like, oh, look, my desk broke. I'll pick it up and keep going. But I was like, if I could have actually laid on the ground because there wasn't candy all over it, I would have done that. I had to sit, as it turned out. But I think that's a big part. We've got to forgive ourselves as we move through the process of coping so that we can get to the beauty and get to the hope and get to the lifting up of others.
Yes.
Thank you both so much for joining us today. I know we're going to continue this conversation and bring you both back and others to share stories about how this campaign is inspiring and impacting the caregivers in our midst during this pandemic. But I just wanted to thank you both, Peggy and Alex, for being on the show and sharing your perspectives and your inspiring stories of caregiver support. So thank you so much.
Thanks, you guys. We love you madly.
Thank you for having us. It's mutual, and can't wait to speak again and share the stories of caregivers and those who are recognizing them. Thank you.
This wraps up this episode of HealthChangers. If you have a story to share around how you are recognizing caregivers with #LookLoveLift, please reach out to us on social media or send us a direct message. We would love to share your story on one of the next episodes of HealthChangers. You can find more information about Archangels at their website, www.archangels.me. And you can find more HealthChangers episodes at cambiahealth.com. You can also follow us on Twitter at Cambia, CAMBIA.